Welcome to the Kaleidoscope, Healthcare in a Diverse America, from molecule to market, with your host, Sheila Thorne. Each episode highlights healthcare leaders and patients of color to discuss culturally, linguistically appropriate strategies and services. You can find this show on all major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Now here's the host of the Kaleidoscope, Sheila Thorne.
Hello. In 1960, the population of the United States was approximately 88% white. Since then, there has been a diversity explosion in America. Unparalleled, unprecedented, irreversible, seismic demographic shifts have changed the complexion of America. It's getting darker. Blacks, Hispanics, and Asians accounted for 92% of the U.S. population growth during the previous decade, with Hispanic Latinos accounting for over half of that increase. More than half of the children under the age of 5 are Black, Hispanic, or Asian. By 2024, children of color will be the majority of children in America. 87 million millennials is the most racially diverse generation in American history. At the same time, the 2020 census recorded for the first time since the census began being taken in 1790 that the number of Americans who identify as white declined 5.1%. So if you're not woke, and I'm not quite sure what that word means or if you like it, these statistics should be a wake-up call. America has never had a homogeneous one cultural population, but for a long time, we pretended that it did. We in healthcare pretended that it did, and we got away with it, but no longer. America is a beautiful cultural mosaic. Contrary to popular opinion, we are not a melting pot. That would mean that each group comes here and harmoniously blends together as one. We may aspire, some of us, to be a melting pot, but we're not quite there yet. These dramatic shifts in the demographics are frightening people. It's no wonder that we have these toxic debates about immigration. Anyone that looks different always has a challenge when coming to America. But how have you responded to the diversity explosion? How has your company responded? How has your organization responded? How has your team responded? How has your board responded? Have you reacted to this demographics in this diversity explosion? Or how are you building your clinical advisory groups, your peer-to-peer programs? Are you finding principal investigators to do clinical research of color? What about your media buys? Are you advertising or giving information to Black, Hispanic, Asian, and Native American publications? Or is it something you just relegate to Black History Month and check the box? We are way beyond cultural sensitivity, which is just an awareness of difference. It's sad to say that while most Americans are healthier than ever before, with preventive care, access to care, and also having the opportunity to have health information, most people of color, all people of color, less healthy, less screenings, diagnosed later, treated less aggressively, inferior care, premature diseases are preventable, but unfortunately these populations do not benefit from the benefits of biomedical research. These are people who need information. Far too few that I've come across in my almost 30 years of doing this work in the multicultural space for the healthcare industry, far too few really understand and appreciate the significance, the magnitude, the potential, and the promise of reaching out and engaging communities of color, people of African, Hispanic, Latino, Asian, and Native American descent. Or maybe you've had a thought like a brand manager said to me once, "Oh, Sheila, those people are sick because they're poor. We can't solve poverty. They can't buy our drugs." Hopefully, you're not stuck in that stereotypical image of communities of color. But in 2020, the dynamic changed. It took the horrific murder of a 36-year-old African-American man by the name of George Perry Floyd Jr., who was murdered at the hands of unethical, inhumane police in the streets of Minneapolis. It got a global response and illuminated glaringly injustices. But it wasn't until that novel coronavirus that I heard about with my public health friends and colleagues in the summer of 2019 that things began to change. By the time that virus made its way around the globe to America, we knew in the summer of 2019 that it was going to devastate communities of color, and it did. More infections, more hospitalizations, and more deaths. Clearly, this was a wake-up call. And then there was a flurry of diversity trainings and listening sessions, and the positions of chief diversity officer, chief equity officer were rampant. It increased by 123%. But do those people have the right mindset, have the right heart set, have the right skill set to absolutely outreach culturally appropriately with cultural humility so that we can engage these Americans and make sure that they receive quality, affordable, accessible, equitable healthcare? So clearly we need to take a look at whether we are making a difference in these communities, or is it just relegated to your human resource department? Is it woven in the fabric of the whole country? The reason for health disparities are complex, so the solutions are not simple. We definitely have to come together in our collective wisdom to figure out how we can make healthcare available to all Americans, no matter what they look like, where they come from, or what language they speak. I've been in this space almost 30 years, and this is the time. The moment is now. It's the watershed moment. We can shift the paradigm and focus on these communities who have been marginalized, underappreciated, undervalued, and misunderstood. The time is now. In the words of the late Maya Angelou, a poet laureate, civil rights activist, award-winning author, said, "It's time to step off the road and cut a brand new path." Are you stuck in the pilot market mentality where you think this might work and you don't put enough resources after it so it really can achieve its full potential? Are you looking at multicultural outreach and engagement as a cost instead of an investment, a market development investment, a strategy to engage new voices, new consumers to help us eliminate health, racial, and ethnic health disparities? To all of you who have stepped into this space, kudos to you, compliments to you. It's not difficult to see that there is a spirit out there that wants to do better and wants to do right. So shift over from diversity training. That's not what you need in order to weave this to your organization. It's cross-cultural education. Why do these groups behave the way they do? How can we do a better job of engaging them beyond just linguistics? Sometimes the clients that I work with are more appropriate to go after the Hispanic Latino population because they have translation. One brand manager said to me, "Why do we have to do anything different for Black people? Don't they speak English?" Well, that's the level of cultural consciousness that we have to eradicate. We have to make sure that we are educated about the history, celebrate the culture, celebrate the individuals, embrace them within the context of their unique needs and concerns. It's not easy, but it's doable. And I challenge all of you in the healthcare industry to take on this charge. And if you are the only one of color in your group, in your team, in your franchise, be bold, be courageous, put it on the table. It's been the pink elephant in the room for far too long. We have to remove it so that all of us who are deserving of quality, affordable, accessible, culturally competent healthcare can achieve our most healthy status in life. That's health equity. Don't jump over the disparities. You still got to eliminate those. You may strive for health equity, but right now, from my perspective, that's aspirational. Let's put our boots on the ground and our feet on the street, meet the people where they are so that they can understand why they should take charge and control of their health. And more importantly, how they can do that. That's where we are, ladies and gentlemen. This moment may never be repeated in history. It's time to step off the road and cut a brand new path. And there are two roads. The one less traveled is the one I'm suggesting to you, but has all the benefits if you really engage and reach out to, regardless of your race or ethnicity. Be bold, be courageous, and have cultural humility so that all Americans can embrace culture and be there for their families and their communities. That's my goal. That's my passion. And the Kaleidoscope is going to bring to you the voices of patients, patient advocates, providers, researchers of color. We've been talking about this for decades. It's time we stop talking and take action. And so it's my privilege to introduce to you my first guest during this Breast Cancer Awareness Month to talk to you about his journey. But I think all of you know, Black women are more likely to receive a diagnosis of metastatic breast cancer, be younger in diagnosis, and have more fatal outcomes. Black women are diagnosed with de novo metastatic breast cancer at 50% higher rate than white women. Black women are more likely than white women to die of breast cancer in any age across any subtype. Black women have the lowest 5-year survival rate compared to all other racial and ethnic groups for every stage of diagnosis and every breast cancer subtype. These statistics are unacceptable. And these statistics are not just with people who have been marginalized, but people who are middle class and insured. We've got to change that. We've got to make sure that these women who are given very unique and special concern have what they need to survive, and also to see whether early diagnosis will be where they need to be by screening. We've heard a lot of that this month so far, and I hope the women who are out there are taking it to heart. Clearly, we don't want to see any more women of African descent die from something that may be treatable and preventable. But I'm going to introduce you to someone that you may not be aware can tell you about breast cancer in Black men. He's my friend, he's my colleague, and he graciously accepted the opportunity to speak to all of you about his experience and his journey. I'd like to introduce you to Derek Andre Perkinson. Welcome, Derek. Derek, we can't hear you. You have to unmute yourself.
Thank you, Sheila. Thank you for that warm introduction. I hope you can hear me now.
Yes, we can hear you very well. But before we get into your journey of breast cancer, Derek, I want to tell them a little bit about you. Derek is president and founder and CEO of D Perk Consulting. He has an extensive background in advertising, marketing, and sales. He specializes in crisis management and large-scale field operations, and I can attest to that personally. I've worked with Derek on a number of initiatives in New York City and New York State, and like they say in the hood, he the man about pulling people together and galvanizing them around an issue. He's a native New Yorker, born in Harlem and raised between Harlem and the Bronx, and I'm also from the boogie down Bronx, Derek, so I don't know how we didn't meet before this. But he's moderated panels. He has received numerous awards from New York State senators, assembly people, and he's been noted for his strength and commitment to community and his outstanding work in galvanizing voting rights and social justice. And just recently, in August of this year, Derek was chosen to be the first ever male breast cancer survivor spotlight speaker for the American Cancer Society, and making strides against breast cancer to share his journey and to spread awareness. You know, people of color are very private about their health issues, and especially Black men. We don't readily reveal things about our health status, and that too is a problem. But Derek, you've been courageous and you've been bold, and I want you to tell our audience exactly how your journey began on February 10th, 2021. At the age of 50, what did you learn?
Thank you, Sheila. Thanks again, and congratulations on this podcast. No person is more deserving.
Thank you.
On my birthday, my 50th birthday, Sheila, a year after the pandemic, I have a sensation in my right breast. It feels like a splinter. 2 days earlier, I just left the doctor because of a weight loss. So the weight loss really identified as finding the lump between under the fatty tissue. I go to the doctor. He tells me, Derek, that has to get cut right away. So he gets me the mammogram. He gets me the biopsy. And on April 7th, 2 months later, I was under the knife to receive my mercy scar, I call it. Because if you had a choice, would have a scar for the rest of your life on your breast, or to not have a life, I think most of us would choose the scar. So it's the mercy scar. And you only.
But wait a minute, Derek. Tell me, when you got that diagnosis, what was your first impression? And did you tell your family, or what went through your mind when you heard that diagnosis?
Wow, it's life altering. You immediately think of death. I had a father who I lost in 2010 to this disease. I had an aunt, a close aunt, in 2018 who also lost to this disease. Both went down fighting all the way through. So I thought the worst. I thought gloom, doom, depression. I thought death. We had the two rappers that was my age that I'd seen in the neighborhood growing up, and DMX and Black Rob, and they were gone, and they were dead too. So I thought I was a goner, and it was telling me it was stage 2. So I caught it early. However, it was still stage 2, and with those diagnoses, you never know how it's going to work out. So I thought, Sheila, I was in a dark place. I thought it was over.
Wow. And how did Nakia and your 5 children and 7 grandchildren and 2 godchildren, did you tell them?
I told them all, and my mom, and they were very supportive. They were very scared at first. A lot of them didn't know the seriousness of cancer. You know, they hear about it. They know their aunt and grandfather's been through it, and they were very supportive. They all embraced me. However, when you're on this journey, Sheila, when you go in that radiation room, when you go in that chemotherapy room, which I didn't have to have, which is a blessing, you're by yourself. So no matter how many people can hold your hand, when you're in these situations, you're by yourself. So I like to say no one fights alone, and I'm sure did not fight alone. I had my mom, my wife, my kids, and my godkids and the grandkids with me.
Well, that's a very common thing in ethnic populations. The family gathers around, the family supports and embraces. And so I'm very happy that you had that blessing. But had you heard about breast cancer in men before this diagnosis? Was that a surprise to you?
It was a big surprise, because the reality is that breast cancer does not discriminate by gender, and this disease can affect men as well. And I didn't know that, but I used to do my research during this process. I was very well informed by the doctors that I had, and Dr. Sung out of the American Cancer Society. She saw that Black men face significantly higher risk of breast cancer.
Really?
To our white counterparts, and the study found breast cancer incidence among Black men are 52% higher, with disparities present in all breast cancer subtypes. So when I found these things out, I knew right away, being an advocate and activist, I need to put my hat in this ring as well.
Interesting. And didn't you tell me that the year you were diagnosed, there were 7 more men diagnosed with breast cancer?
Shirley, that's exactly right. The doctors informed me every year maybe 1 male would come for breast cancer diagnosis and treatment. And this year, the year I came, 21, 7 of us was diagnosed. And they're still trying to figure out what was the uptick, why the uptick. We're still trying to figure that out.
Trying to study that. Talk about your encounter with the physicians and the team that was working with you. What was that like for you as a Black male?
It was great. I mean, I was blessed. Again, I had a family member who was in another hospital, which was very well renowned. However, being that and it might not be fair, but being that she found, ended there, I figured I'm not going there. I want to go somewhere else. But I was lucky to have good care at the Inglewood Breast Cancer Center in Inglewood, New Jersey. The doctors, surgeons, the oncologists everyone were very welcoming, very patient, and very informative, and even definitely allowed me to research and do things on my own to be sure about the decisions I was making on my own, but based on a lot of data and information. So the doctors, I can't thank them enough for the care they took in me. And I even go to treatment today. I just found out, actually, 2 years later, I'm going to physical therapy where they loosen the tissue once a week. So I'm taking advantage of many of the opportunities and resources available as I can.
Well, how did it work with the aggressive work you do in the community and the civil rights and the voting rights and all those activities? How did you manage that in the process of your treatment and your therapy?
That's a good question. I'm glad you asked that, because that's what kept me going. The work kept me going. So when you have the work in front of you, you get distracted from your doom and gloom, from your treatment, from your the treatments, because I had to do 6 to 8 weeks of radiation treatment on my chest. It was 21 sessions, they counted 21 blocks. So after doing the treatment, you still go to work. You go about your day. After the treatment is over, you have to put this cream on to heal from the burn of the radiation. And that was very uncomfortable during the day, and it's burning all night. So the recovery was but the work, Sheila, keeping with the legislative work, keeping with the activism work, it kept me going and distracted me from the treatment. So I was lucky in that sense.
Well, it definitely sounds that way. Talk a little bit about your conversations or your decision-making with your healthcare team. What was that like in terms of finding out what would be the best regimen for you?
Well, we got into a lot of deep discussions. Luckily for me, I was a little well informed, not well informed, but a little informed about cancer.
Mhm.
Being that my dad passed in 2010, in 2018, I lost my aunt Beverly. So I had a little groundwork to work with. So what
Mhm.
I've discovered was that with the advancements in research in cancer, we are
Mhm.
making a lot of good advancements. And I can't say that enough. They put
Mhm.
it into one of three boxes, they call it. We could put it in box A, B, or C. If it's A, this is the most minimum treatment you need. B is in the middle, and C is like you may need chemo, you may need to work. So
Mhm.
they have it down to a science where they know what treatment goes into each box,
Mhm.
and they keep the research up. So I was very encouraged to hear that.
Mhm.
When you're going through this, you're always going to run into others who've had it. All
Mhm.
of us people you know for years, they never
Mhm.
shared, and they say, hey, I did that 20 years ago. Who would have
Mhm.
known? And then they tell you about their recovery and they different things. So the doctors were very, very, and everybody stayed in their lane. If I asked
Okay.
a surgeon question, to the oncologist, they would send me back to the surgeon. If I asked the surgeon a
Mhm.
question, and if it was an oncology question, they give me a little background, but they say, you know what, we're gonna send you back over here. So they made sure whatever question I asked, they would send me back and forth. They would not answer on their own if it wasn't their lane. So that would
Mhm.
make me feel much more comfortable as well.
Mhm.
And they were very informed. And again, I didn't take everything they said just because I also did my own research, and I encourage
Okay.
others as well.
So that process of going through the team, as you will, your surgeon, the oncologist, and everybody else, definitely helped to keep you informed about what you were going through, and
Yeah,
that's important.
and this is the first time I'll say this out loud. My wife knows. I even went to a physical a therapist. I went
Okay.
to a therapist, a counselor, to talk about the darkness, to talk about
Mhm.
all the things my body was going through. As a man, we look at ourselves. We don't have breasts. We have chests. We are
Right.
man. Beat our chest, and now I look in the mirror and I look at my chest and I see the mercy scar.
Mhm.
And again, at first, it was a thing of looking at yourself mutilated and looking at a different
Mhm.
body, and you
Mhm.
start getting stupid thoughts like I'm a half a man now, and all that stupid stuff.
Mhm.
But then you come into faith and realize that you're blessed to be here and to keep fighting, and you're here for a bigger purpose. So
Well,
now I'm here on a different purpose. You can't take life for granted,
that's right.
So we push hard
Mhm.
because we have a second chance. So yeah, I was very comfortable with the doctors.
Mhm.
Everybody stayed in their lane, and everybody was very well informed, and they let me know step by step what was happening, what was going on.
It sounds like your engagement probably motivated them to respond in kind. So, is that some advice you would give to other Black men about how they take care of their health, whether they're diagnosed with cancer or not?
Absolutely. I mean, our men need to get treated, checked up at least twice a year, every 6 months.
Mm.
I have a friend after my diagnosis sharing my story. He told me he's about a couple of years older than me. He's had a lump for the last 10, 15 years on
Oh
his
my
chest.
goodness!
And
Wow.
he's never been to the doctor to get it checked out. I said, are you serious?
Mm.
So he finally did it. It took him another year after that conversation, but he finally did it. So I am making a difference in that sense. Our men
Mm.
have to, we don't think we need the doctor until something is wrong with us. And that
Exactly.
is the problem with
Exactly.
our Black men. We're not going to the doctor unless we're hurting. Our head hurt, our
Yes.
stomach hurt. But a lot of times it's too late for that. So we have to
Yes.
be proactive. We also know that eating right, the things you
Mm.
eat, learned a lot about cancer, and things you eat and put in your body. Cancer can't survive if you eat right. And
Mm.
if you don't have certain things in your body, cancer cannot survive in this environment, our vessel.
Wow.
So we need to learn about all of these things and see what applies. Each person is different. See applies to yourself, and then move appropriately towards avoiding cancer and being
Yes.
preventive.
That's exactly right. Now, tell me a little bit about your follow up. You're not cancer. You are cancer free at this point. But
I am a
what do you have to do in order to maintain that?
Okay, well, they give you a medication for the next 5 years. I have to take this pill,
Hmm.
tamoxifen,
Uh
one
huh.
pill a day for the next 5 years. Is an estrogen pill. It's to
Hmm.
prevent the cancer from coming on the left side of my
Mm.
breast. It's a small percentage, basically, of the cancer coming back, but
Hmm.
this makes that percentage even smaller,
Smaller.
so to
Okay.
speak. And that's basically it. I go to my physical therapy, which I just started maybe 3 4 weeks ago. Um,
Hmm.
and I just stay on top of my health. I try to keep a proper weight. I try to
Hmm.
eat right. I don't try to restrict my diet, but I
Hmm.
do try to eat certain things that I know is healthy, and I try to eat portions. My portion controls as well.
So, in spite of the discoloration of your skin, as you say, is there anything else that you have to do on a regular basis to keep healthy?
No. After the skin discoloration is slowly coming back, but it probably will never come back totally.
Mhm.
However, there's nothing, no protocols, nothing in place. Just the good thing actually is every 3 to 4 months I get checked up thoroughly,
Okay.
full blood test, full everything.
Mhm.
Before the first surgery, they give you a full genetic testing, which
Mhm.
shows you a lot of things historically, what could be in your body, what not, and they that's a good baseline. So
Mhm.
once you have that genetic testing, they build
Mhm.
everything from there as well. So it that's a blessing. I will
Mhm.
always go to the doctor every 3 or 4 months. I'll get checked 4 times a year, versus
Mhm.
advocating for men to get twice a year, and they always stay on top of things. So any signs of the cancer coming back, they'll be right on top of it
Right
before it
on
happens.
top of it.
So
So,
that's the
what would your advice be to Black men as you talk to them and raise their awareness? What do you think will get the message clear to them that they are too at risk for this cancer?
I want our brothers and sisters to know, especially our brothers, to know that you have to get regular checkup. Get an annual checkup. If you're going to do it once a year, fine. I suggest twice a year, every 6 months.
Mm-hmm.
Definitely get a cancer screening during that checkup.
Mm.
And I'm going to talk about lifestyle choices. It has to be some physical activity in your life. I was lucky because I went from a 44 waist, and I lost over 60 something pounds, and I went down to a 34 waist, and
Mm.
I was able to detect the lump under my breast. So
Okay.
those of us that's not, you know, in physical shape, please get active.
Mm-hmm.
Mental health, being a part of this, is very strong as well. It's very important to have a
Mm-hmm.
strong mental health, because when you go through dark times, you have to be strong enough mentally to know you're going to get through it.
Mm-hmm.
Always know you're going to get through it, and you never fight alone. Prostate cancer, and
Mm-hmm.
you have to be aware of colorectal cancer as well.
Mm-hmm.
Skin protection. I know we
Yeah,
just left the summer, but a lot of our people also, Sheila, we do not wear suntan screen.
that's right. They don't think we tan. I get a tan when I go to the beach.
We don't wear sun protection, so that is something important. And we all know someone who was affected by cancer, or we lost to
Mm-hmm.
cancer, or survived and is a thriver of cancer. So we need to support these community groups
Exactly.
that doing the research, because I've seen the research where it's came from and where they're at now, and I see the research is working. So they need to keep
Mm-hmm.
researching so we can eradicate cancer one day, and that's the
Yes.
goal. And always be educated. Always be
Yes.
educated on,
Yes.
and be aware of what's going on with the local
Mm-hmm.
news, the daily news, the current news. And
Mm-hmm.
it's very important to know your family history. I mean,
Yes.
you start with your mother and father, go with your grandparents if they're still around, but get to know their history so you know the odds of you having cancer are higher or lower, and you adjust your lifestyle accordingly.
Well, to have you as my first guest on the Kaleidoscope is certainly an honor and a blessing. And I hope that your message can resonate with other men, other Black men, and even their partners or wives, to encourage them to get checked regularly and to change lifestyle. Those are important messages across the board. So congratulations, Derek. I'm glad and happy that you are surviving and you're thriving and you're giving back. And that's what's important, to be a spokesperson for breast cancer in Black males. So thank you so much for your insight. And I hope that everybody can benefit from your words and your survivorship. Thank you so much.
Thank you, and thank you for having me for your first show. It's a big pleasure and honor. Thank you, sister.
Okay, very good. Well, we have to be together. I mean, each one of us can help all of us together. So we've got to stay informed, listen to those who look like us, and your voice definitely will resonate, and how to reach Black men, not only about breast cancer, but other health issues, because that's been a challenge over the years. And so with that, I'm going to conclude my first episode. Thank you to Derek A. Perkinson, President and CEO of D Perk Consulting Group right here in New York. And we wish you good health. And I
Thank
welcome
you.
all of my listeners and viewers to come for our next episode, where we're talking about health in the Hispanic community, because we're in Hispanic Heritage Month. And so we need to figure out how all of our brothers and sisters who are entitled to quality, affordable, accessible, equitable, culturally competent healthcare. It is not a privilege, it's a civil right. Thank you.
You've been tuning into the Kaleidoscope, Healthcare in a Diverse America, from Molecule to Market, with your host, Sheila Thorne. You can find more episodes on all the major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.